So I'd like to welcome Paul Ellingstad to the stage. Paul is within Hewlett-Packard and has been deploying technology for social innovation, in particular in the healthcare space. So a slight change of focus towards the role of technology in social innovation and health. So over to you.
Thanks, Colin. So just picking up on that, I suppose there are a few people that probably thought, HP, the H isn't really for healthcare. What is this guy from a technology company doing talking about healthcare? And picking up on something that Justin had covered about duality, I think what's interesting, what I see in work and personal life, and particularly in work life, we don't wear sort of one hat. We don't have one particular specialization, and that goes for companies as well as individuals. And I think before I get into the specifics on healthcare and what we're seeing in terms of driving sustainable improvement in health through technology, and also from the business side as well as from a social impact side, I'm reminded of a lesson that I've learned from my personal life. So while I'm working on global health issues and dealing with lots of, let's say challenging as well as innovative people during the week, this past weekend I put on a different hat. I got to play dad for a while again and worked with my 6-year-old daughter to build an IKEA bookshelf. Now, I don't know who's bought anything from IKEA. It is pretty intuitive, and from talking with someone this morning, we were talking about the elegance of design is products that are intuitive, that you don't need the instruction manual. And that pretty much held true for the weekend as well. I thought, this is a bookshelf. There's a couple of things to screw together. There's about 10 pieces. What can go wrong? Trust me, when you have a 6-year-old saying, "Dada, use the instructions, you're gonna mess it up," it rocks your confidence. And luckily for me, though, I was able to make this bookshelf, but that didn't really sort of deter my daughter from saying, "We better have Mama look at it, and I'm not sure if you did it right." And I use that as an example because what I see today in my daily work and out in the marketplace is that we live in a very complex world, but we take this sort of flat pack approach to how we solve problems. And instead of sort of developing the process, instead of following the instruction manual, or at least creating an instruction manual, there's so much, excitement, resources available that we jump right into the solution solving. And I think like any good construction project, the first thing that you should really do is understand what is the process, and do I have all of the pieces, all of the parts, to put this together. The reality, and what we sort of aspire to, is particularly in business, you start with who is your client, who is the customer, what are their needs. You define the problems, the challenges that they have. Who are the other players? So many times today, companies don't work on their own to deliver goods, to deliver services. They work in an ecosystem with other partners in that as well. So really defining that context, even looking at who your competition is, and then defining the solution. And then within the solution too, what we increasingly see, particularly in terms of social impact, is that the funders are different than the quote-unquote clients, or the people that we're trying to deliver these particular solutions for. You have implementers, and you have sort of the ongoing sustainable approach, the maintenance for the solution as well. And all of that should flow from who is the client, what's their problem, who are the other players to bring together the solution, what's the solution, and then how you deliver that. That's a fairly clear-cut, straightforward process. The reality is that today, and a lot of this I see is driven because of resources, and the folks who are bringing the money to the table or the other resources to the table are sort of defining the solution and then going in search of the problem or the clients. And it's much like Maslow once quipped that if your solution is a hammer, every problem starts to look like a nail. And that's clearly what I've seen for technology companies, for foundations with large trusts, whatever the type of organization is, an NGO, with a large workforce. Starting with, what is my competency? What are my resources? Let me go looking for a problem instead of stepping back and saying, what exactly are we trying to solve? Who else is trying to solve that problem? How do we work together to define a solution in a sustainable way, contributing to a long-term solution, rather than just sort of putting our cards on the table and doing what we're good at? So a bit to what Justin was talking about, and consulting with our elders and that, I think going back to my kids again, what I've seen time and time again is that when we rush into the solution, even when you have the resources, much like the Coyote and Bugs Bunny Roadrunner show, looking to catch the Roadrunner, you can ship off for the solution, you can buy the rocket, you can try to put it together, but if you haven't really thought through what exactly is the solution, how are we trying to achieve the end goal, if you go it alone, you're going to wind up in disaster more times than not. Now, luckily for us at HP, sort of standing on the shoulders of giants and really learning from our elders, the founders of the company, Bill and Dave, very early on in the company's history, were asked by employees, why does this company exist? And Dave said very, very clearly to employees, it's not just about returning shareholder value. It's not just about the profits. It's also about what is the contribution that we're making to society. And I think this is the exciting bit today for companies like HP, for the market, for the society as a whole, is that more and more companies, whether we're calling it shared value or social innovation, are looking at a more sustainable approach to business and how we can actually solve societal issues while at the same time pursuing business as well, business objectives. So I want to take you through just briefly one of the solutions that we've been focused on and how we've taken sort of the aspirational approach to problem solving. A couple people on the slide here. In terms of our clients in the health space, this is maybe a little bit more difficult to separate. On one hand, we have Mark Bohr, the permanent secretary of the Ministry of Health in Kenya. In one way, Mark is our customer, our client, because we're working on his behalf to improve the health service, but he's ultimately accountable. The woman on the right there is actually a citizen of Kenya, and her child was in for HIV testing. So on one hand, we're looking both at who is the end customer, but then also who are the partners that we're working with, and really putting faces and names to the problems and the opportunities and the needs that we're addressing, not just an org chart or a schematic. The problem, one of them that we're trying to solve, is infants that are dying of HIV. Today, roughly 350,000 infants a year are dying from HIV. The real kick here is that all of those deaths are preventable. We have the technology, we have the resources, we have the wherewithal. It's simply a breakdown in the system today. And you can blame it on the funding, you can blame it on the process, you can blame it on the whole system in general. But the good news is that we actually have the solutions today to prevent those 300,000 deaths every year from HIV. The problem with that is that if infants go undiagnosed and untreated, there's a 50% chance that they'll die by their second birthday. And so that's really what we're trying to do is improve the process so that we can get all of the infants that are at risk tested and then started on treatment. So the reality of how we do this, it's not just about technology, and I think a couple people earlier today said, technology is not the silver bullet, it's not the magic cure-all, but it's definitely an enabler. And what we've realized is that working with the government, working with universities, so bringing in students who are actually able to help create the solutions, thereby creating jobs for those students as well, working with the pharmaceutical companies and even the telecommunications companies, we're able to put in place a very complex but very effective system that now is allowing infants to be tested. Last year in Kenya, for example, 65,000 infants tested, 10% of those diagnosed with HIV and started on antiretroviral treatment, and their chance of surviving past their second birthday now is more or less assured because of that change, because all of these different players have come together to work within the system. So I'll just close with that in saying that what really is important here as we talk about sustainable solutions, business working with government, there is an opportunity to create business, but there's also an opportunity to do this in a sustainable way, working within an ecosystem, taking that process, and instead of just sort of jumping into a solution and going and looking for a problem to apply that to, instead of taking this flat pack approach, step back, understand the system that you're working in, the process in which it works, and then truly collaborating with the other partners as well. Thank you.